Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa and your host, Greg Phelps.
This podcast is brought to you by Joy's House. Joy's House serves adults living with life-altering diagnosis and their families by providing exceptional adult day and caregiver services. With 2 Indianapolis-based adult day centers, Joy's House offers safety and community for their clients while offering peace of mind and respite for caregivers. For more information, visit joyshouse.org.
Hello and welcome to the Dementia Care Partners podcast, brought to you by Positive Approach to Care. I'm your host, Greg Phelps, and joining me as usual is dementia care expert Teepa. And Teepa, every time I'm sort of doing prep for our program, I come up with all sorts of different terms or phrases or knowledge but here's one that I wasn't really too familiar with, and I'm probably going to say it wrong. Anticholinergics? Am I pronouncing that one right? Anticholinergics, used to block a neurotransmitter, blah, 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 learning, memory, muscle functions. Is that something that is related to dementia, or am I mixing metaphors here?
Okay. It's this proposal that this is what would do these things. But I think, the goal is to look at how could we prevent things. And I'm not sure prevent is the right word. How could we reduce risk? How could we do something that we think might have some impact? And to propose it as a hardcore, this is the thing that's going to do it, is like, wait a minute, how do you know that? Or why do you think that? Or what actually is going on there? And the challenge is, how are you measuring anything? And what exactly is it you're trying to do with this thing you're giving somebody? So tell me a little, Greg, from your perspective, what did you take away from what you read? So I'm curious because we try to figure out, so what did you think after you read that?
Well, I had my head scratcher on, and I was sort of going, okay, this type of drug can cause dementia-like symptoms in people without cognitive impairment. And I thought, ooh, okay, well, that creates all sorts of problems. And then, of course, there's a study, because that's what we like to do. We like to study and then publish things. A study of adults 65 plus found those who took anticholinergic drugs for 3 or more years, it's a very long time, or higher doses for a short time, had a 54% higher dementia risk. So I always, when you hear these studies, I'm still trying to process this. Like, how do they determine this?
Yeah. So a cholinergic medication is one that facilitates the production of a cholinergic reaction in the brain, which is to stimulate the brain to do something. Remember, think, consider. Okay. So an anticholinergic medication might be involved in reducing that level of activation. So it turns out that there are a number of medications you can take for other health conditions. So for instance, if you've ever had an allergy, some of the allergy medications, and particularly one that comes up a lot, is Benadryl, because Benadryl is really effective at keeping your body from reacting to allergens, allergic reaction. And that's an example of one of these. We also have those same kind of medications in sometimes cardiac medications, or sometimes medications that are used to solve other problems, like anxiety medications, or drugs that are used to treat epilepsy, or, so there's all kinds of places that we might find this kind of thing, things that reduce this cholinergic activity. Because it turns out the cholinergic activity is also active in your gut for digestion. It's active in your bladder and your bowel for elimination or control over it. It's active in your brain as a stimulant kind of thing, getting your brain active. So if you're taking something that reduces the availability it might be affecting how many times the synapses are firing, how much the synapse is actually active. And if you keep doing it over a long haul, of course, all those medications, believe it or not, say things like take for only 2 weeks unless advised by your physician to continue. And if physicians don't measure your cognitive abilities before you start the med and keep up with your cognitive abilities over time, guess what they might be missing, Greg?
So many things, Teepa, so many things.
And so you're taking these meds to be supportive of living well, because if you have a lot of allergies, it makes you groggy and sort of feeling out of it. So you take the Benadryl and it clears you up, but it does make you a little sleepy for a bit. And then it sort of doesn't make you sleepy anymore, the quote unquote, kind of thing. So you think, okay, this will work. But apparently it might affect your cholinergic system. So how complicated does this sound to you?
It sounds really complicated. Then I read on further on into the study that it says never start or stop or adjust the dosages. So, I'm sort of stuck here. I can't start, I can't stop, I can't adjust. So are
Yes.
these beneficial or are they harmful?
Yeah.
How
And
does
so
the average person who's seeking information get anything out of these studies or warnings or conclusions or
yeah.
anything else? Is it good, bad, evil? What is it?
The interesting thing, Greg, I listen to NPR a good bit. You know me. I'm an NPR, public radio kind of listener. And we have something called the People's Pharmacy that comes out of North Carolina. It's been around forever, a long time. Joe and something Graydon. I can't remember her name, but Joe and Terry Graydon. That's it. And so I did remember. See, a La Paz. So what happens is they just this weekend we're talking about over-the-counter meds. And a lot of these meds that we're talking about are either over the counter, or even if they're prescription, you get used to them and you're moving on. And nobody's looking at what's my baseline and is my baseline changing? So this gets tricky because we're thinking that physicians are still operating as physicians did probably 30 years ago. They aren't. We're thinking that pharmacists are readily available. They're not. We're thinking that everybody's keeping up with the Beers report, which is basically which meds are seriously challenging for people who are getting older. Oh, there's a Beers list? Says many doctors. Oh, yeah, I read that once. And it's like people are not keeping up with all the new things that are happening. So my suggestion is talk with a consultant. Talk with somebody who can help you think about what's the pro, what's the con, what's the benefit, are there other options? I mean, there are even meds that you can take to keep your bladder from not releasing when you turn the key in the door if you're a female, called urge incontinence. Unfortunately, one of those can affect your thinking, and one is not so likely to do that. So it's not just should you take a med, it's like which med should you take to what extent and for how long, and how much do you look at changing your behavior and looking at how long are you trying to hold your urine before you get to the door? Have we asked that question? And so it's complicated, and I can't make it real simple because it isn't.
Where do people turn? Because there's a continuing cycle of new stuff coming onto the market, and new is obviously better. And you're saying that we forgot maybe to look at the baseline.
We forgot to draw a baseline, and we forgot to be curious about if it's too good to be true, it probably is. If it says it's really, really good for you, you want to read the label. And this was interesting also on Joe and Terry Graydon. What percent of people do you think actually read the label of medications they take?
Well, if the doctor prescribed it to me and the pharmacist gave it to me, I probably don't even look.
10% or less. So people start taking a med thinking, oh, well, he wouldn't have prescribed it if he didn't think it was the right thing. And so when you have maybe 2 physicians or 3 physicians, or maybe you have multiple meds on board, we're assuming somebody will jump in there and go, oh, pause, hang on a second here. You're on about 3 of them, and this dosage just went up weeks. But that's not what necessarily is happening. So I think it's really a case of I need to find a few trusted people in the world to talk with this about. And so that's what we try to do, is just talk about things. We don't say do this or do that, but what we say is, you know, you're on this, and this. Have you like been able to talk to a pharmacist about the possibility of whether or not these make sense for you at this age, given what's going on? Because you've been on a couple of these. What were you given this for to start with? I mean, and we just ask curious questions with you. So we get you thinking, and then you can choose, when we give you some support, to do some next steps, baby steps at checking out what's happening here. Does it make sense?
Teepa, you're on the road, you're here, there, everywhere. Is there somebody besides you that we can talk to, or do we have to wait and get in queue for Teepa?
Of course not. Now, we do have problem solving with a PAC team on, a Wednesday evening each month. You're always welcome to come on that and be part of it. Ask questions through Facebook or through our media channels, because anytime we get a question, we try to respond and we try to let people know where we responded. And we have consultants and we have people on chat. And our chat isn't an AI chat. If it's just how do you get this product, it may be more AI. If it's I have a question, I'm not sure what to do, you'll get a real life person responding to you in chat, because that's how we handle it. And if you want to make a phone call, we have an 800 number too, because we believe in responding, not just giving you some canned talk.
Take two, call me in the morning.
Maybe call me before you take those two. Wait a minute.
You've been listening to the Dementia Care Partners podcast, brought to you by Positive Approach to Care. For more information on this program and other dementia-related care products information, please go to teepasnow.com. Maybe I should take a pill.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.